me. Today we have Taylor Buchanan, and he is uh, an IT wizard with the LMH Health, and one of those people that know everything. And he said he just confessed he has 800 passwords. So, so I am not worthy. But his topic today is going to be that. And I'll let him speak in a minute. I just want to be glad you're all here and tell you I'm very happy to see you.
Oops, got muted. Laurel, you're muted.
Unmuting.
There you go.
Okay. And I'm very grateful to Capital Federal and also the Katzmans who make these wonderful, wonderful gray anatomy and other things that we do at Retroactive possible. So that's about enough about me. I am going to start recording.
Oh, I already did that. I hit that
You
for
are
you.
on it. Okay. Welcome. Okay, great. Well, it got started, and I'm going to introduce Allison Coots, who will introduce our speaker. Welcome, everyone.
Thank you so much. And we definitely want to say thank you to the library for being such a phenomenal partner with LMH Health as we do Gray Anatomy each month. We have a lot of fun bringing you different topics. And soon we will put a survey out as to kind of what topics you're looking forward to for next year. So look for that coming soon. Also, a few things coming up at the hospital. We just wanted to let you know there is a grandparent class that we offer at the hospital every other month. That will be happening actually next week on March 25th and then again on May 7th. So if anyone's interested in that, the information is on our website, lmh.org. And also want to let you know about a falls prevention class that we have. It's called A Matter of Balance. And in that, we talk a little bit about home safety. We do some exercises and just kind of talking in general about ways that we can prevent falls. So that is also on our website, lmh.org. And again, that is called Matter of Balance. And with that, I will turn it over to Taylor for all the exciting information that he has to share.
Thank you.
Yeah, good afternoon, everybody. I'm Taylor Buchanan. My title at LMH is Integration Engineering Manager. It's kind of a mouthful, but essentially I just manage the team that helps build and maintain our medical record software. And part of that software is a patient portal website where patients can log in and view their information, send messages, things like that. So we're going to walk through that today. We'll also walk through a couple of mobile applications that patients have access to from LMH. And we'll talk about a little bit about some new sort of self-registration and self-scheduling technologies that we're rolling out. So I will share some slides here. Hopefully everybody can see that. So first we'll talk about the portal website. So there's a couple of different ways you can sign up. We do offer self-enrollment, so I'll show you that link from the LMH website here in a second. But if you have an email address on file with LMH, you can go online and enroll yourself. You do have to provide a little bit of personal information just so we make sure we've got the right account matched with the right medical record. But from there, you can set your password and log into the site. If you don't have an email on file with LMH yet, you can enroll in person. So the next time you check in to an appointment at LMH, you can ask to be enrolled, and they'll send you an email with a link where you can click and sign up there. You can also stop by patient accounts in person at the main campus as well, if you don't have an appointment coming.
Prairie Village police are investigating a burglary at Hen House.
What am I going to do for an address?
Police told us the
So to get started, this is the LMH homepage at lmh.org. To log in or sign up for portal, there's this white box up in the corner called My Patient Portal. If we click on that, about halfway down, we've got a couple of options. You can sign up for an account here. Again, this is if you have an email address on file with LMH, you can go through this process yourself. Once you're signed up and you have an account, you can use this top link to sign in. So I'll walk through some of the features of the site today on a test patient. So this isn't my info or any real info, but there is some test information on here that we can look at. So when I log in, this is the homepage. There's some, we call them key results along the right-hand side, things like height, weight, blood pressure, BMI, some lab results, stuff that you'd want to see commonly. We try to show you them right when you log in. Along the left-hand side, we've got some navigation over here where you can manage, you can click through your health record, you can see your upcoming appointments, you can get into messages. So I'll start with messaging just because that's pretty popular. So over here, you've got an inbox link. This is going to look a lot like an email account, but it's more secure than email. So when you're in here messaging with your provider, this doesn't actually go out over the internet. This connects directly to the medical record. It's encrypted. So it's a lot more secure than sending an email. From here, you can view messages that have been sent to you. You can send a message. So we have all of our ambulatory or our clinic providers on here. To start to send a message, you can search by provider name. So I can start to type provider's name. Or if I know the clinic, I can start to type the clinic and it's going to show me all the providers at that clinic. From there, it's a lot like sending an email. So I set a subject, I can send a message, I can attach a file. So if I've got documents I need to send, or if I've got a picture or something like that, I can send an attachment that way that will go directly to go directly to my medical record and not go out over email. Back on the homepage, you can view your appointments. So we'll look at that next. So any upcoming appointments you have with LMH will show here. You can see arrival time and where to go. You can also click the options link here and add it to your calendar. So if you're on your phone or on an iPad or something like that, you can use that link directly to add to your mobile calendar. We do offer a subset of self-scheduling. So if you have a few different appointment types like routine physicals, a screening mammogram, well child check, things like that, you can go through the scheduling process on here, and it's a lot like booking a hotel room. So you'd pick the appointment type you're looking for. It will show you locations and providers that offer that. And then when they have spots in their schedule, you can select a spot that works for you and place yourself on the schedule. Under the health record, this is where we get into the items that are in your medical record itself. So the first link here is more of a summary. It shows you in one page a lot of the same information that's in the other sections. So I'll kind of walk through these individually. The most popular section of the health record is clinical notes. So this shows you notes from your provider. It also shows you any letters or other correspondence that we've sent. So you can click the link to open up a note, and from here you can save it, you can print it. Really, it's your document. So, and this is a copy of directly what's in your medical record. Medication shows you your active medication list. From here, you do have a refill and renew option. That option is really only for controlled substances because those have to be renewed directly by your provider versus by your pharmacy. This does show you everything you're taking, but if you've got something that's not a controlled substance, we request that you go through your pharmacy for renewals. So that's kind of what this red text over here looks like. The vitals and lab section will show you vitals, measurements, any recent labs. My test account doesn't have too much on them here, but we can see some vitals. I can click on an individual result to see my trends. So if I'm curious how my weight's trended over time, I can see that. The radiology and pathology report sections are a lot like clinical notes. So that's going to show me any radiology reports or pathology reports that were completed at LMH. I don't think my test patient has anything on them, but it'd be the same as the clinical notes section. I could click on a report, download it, print it, bring it to another provider if I need to. The procedure section shows you procedure history. So this would capture both procedures that were performed at LMH, as well as anything that was entered as history at like a clinic visit by a nurse. So this shows you kind of a synopsis of the procedures you've had and some details about them if we've got them documented.
Look at your whole medical record.
The document section contains patient education. So when you leave your clinic visit, sometimes they give you a packet of papers with some instructions or education documents. If you need a copy of those documents, you can always come out here and take a look at your patient education from here as well. And this is the same as the others. You can download it and save it for review, print it out from here. The visit and record summary, this is more of a computer readable summary that you could send to another provider. So this gives you a way to generate a sort of computer summary for one particular visit or download your entire record at the top here where it says record summary. This one's a little harder to read than like your notes or anything like that. It's really meant for sending to another provider electronically so that they can upload the information into their own system. So it doesn't look as nice, but it is easier for the computer to kind of, another computer to ingest this way. And you've got a couple of buttons over here. If you do the send button, there are a couple of options. You can send your record via unsecure email. We don't recommend that you do that, but the option's there if a provider doesn't offer secure email. If they do offer secure email, that's the way to go because that means it will be encrypted between LMH and the other provider. Much more secure, much less chance of having data get out there. So. Down at the bottom, we've got a personal information section. So this is a lot of your information coming from a registration system. So if you've got new phone numbers or a new email address or need to change your insurance, you can come out here and submit an update to your registration information this way. That way it speeds things up at the front desk the next time you check in for your appointment. So that's kind of an overview of the patient portal site. We are working on we're always working on some upgrades and things. We're hoping to have a new version out by the end of the year that will be able to offer some more robust kind of features in terms of viewing your medical record. For example, now if you have cardiology appointments and have a cardio procedure done, we can't show you that report right now on Portal, but we are working on that. So hopefully within the next 6 months or so, we'll have a new look and feel for the website and some more features as well. So. If I go back to my slides, we do have a mobile application for Portal. This really looks a lot like the website, just kind of on a format that fits your phone a little better. If you search for LMH Health My Patient Portal on either the Android or Apple app stores, you'll be able to find the app there. It's got our logo on it, so that's how you can tell it's ours. This supports fingerprints or face login if your phone supports that, so you don't have to type your password in every time you want to sign in. By and large, it offers the same features as the website. But if you are taking a picture and you need to send it to your provider, you can use the mobile app to send it. Makes it a little easier to get it from your phone to your doctor that way. We also offer Apple Health. So those of you with Apple phones, iPhones, you have a health application on there. It's a little heart icon. Once you have a patient portal account, you can use that account to download your records into that Apple Health app. And it also lets you connect multiple organizations to that one app. So if you have visits, say at KU Med is alongside LMH, and you have accounts at both, you can connect both of those accounts into your Apple Health app and then see all your records from both places in one spot. This will also alert you when new results come in. So when an LMH provider puts a new note on your chart, or you get new labs or something like that, if you're signed up through Apple Health, you'll get a little notification that says you have something new to review in your record. The data sharing kind of goes the other way too. So if you have a smartwatch, or if you have other sort of smart connected health devices like a blood pressure cuff or a smart scale or a blood sugar monitor that connect to your phone, you can connect those to your medical record through the health app. So you'd sign up through Portal, you'd connect your Portal account through the health app, and then you can pick and choose what you share back to your provider from your health metrics. So if you want to share your blood pressure readings from a connected smart blood pressure cuff, but you don't want to share how often you're exercising, you can pick and choose what to share with your doctor through that health app. And just like Patient Portal, everything's encrypted. It's a secure connection back to our medical record. So your provider would view your Apple Health metrics through a special section in our medical record. Finally, I would gonna go through a couple of new features that we just started to roll out that are a little more interactive. So we have started with self-registration with a company called Notable. So for those of you that have had appointments in the last few months, you probably received text messages or emails with a link where you can start to go through and complete the the registration process a few days before your appointment. And the goal there is to speed up your experience at the front desk when it does come time for your appointment. So you can walk through the same kinds of things we ask when you go to check in. So if you have health insurance updates, if you've got a new photo ID or a new insurance card, you can snap those on your phone and upload them that way. You can also pay your copay. So if you do a copay for a visit, you can pay right there on your phone. We don't actually charge your copay until after the visit, just in case something comes up. If something gets rescheduled or canceled, prepaying that copay won't cause anything weird on your credit card. That will save some time at the front desks. When you start to check in, you can tell them that you've checked in online, and you'll breeze through that a lot quicker than if you hadn't filled out the questionnaires. We're working on expanding that sort of self check-in functionality. So right now we mainly ask registration related questions, but coming soon, we're going to start to ask some more sort of medical history related questions as well. That way we can speed up the nursing intake side of the process too. So once you go to the back, if you filled out these questionnaires a couple of days before your visit, that will streamline that intake process as well and get you to the doctor quicker. Our primary care clinics also started offering something called digital arrival last month. So that's an additional text message the day of an appointment with your family practice doc, where you can check in online. So when you get to the clinic and you're in the waiting room, you'll get a text with a link. You can click that link to say, hey, I'm here. And that will automatically check you in. No need to stop at the front desk at all. That's only for visits that qualify. So if you do have things that need to be updated, if you have new health insurance or something like that, you won't necessarily get that text message on every visit. But if you are in a situation where you can skip the check-in process, you'll get a link and can tap on that and then wait for your name to be called. You can skip the front desk completely. So right now that's only at our primary care clinics. We rolled that out, I think 3 weeks ago, a month ago. But that's coming soon to the rest of the clinics as well. So something to look forward to there. You probably also started receiving text messages. Well, those of you with a PCP or a primary care at LMH, for self-scheduling for certain preventative measures. So we offer self-scheduling for your annual wellness visits, Welcome to Medicare if you're a new Medicare enrollee. Also screening mammograms. If you're due for a screening mammogram, you'll get a link. You can click on that. And then the self-scheduling process is a lot like, again, a lot like booking a hotel room. So we show you the providers that are available. We show the time slots that you can book yourself into. With 3 or 4 taps, you can book that appointment and you're done. So it's a much faster scheduling process than playing phone tag with the clinic. So we offer that today for those 3 kind of appointment types. We've got some more coming soon. So well child checks, folks with diabetes management and cervical cancer screening appointments will be next on the plate there. So when folks are due for those particular preventative measures, we'll send you a text or an email and you can schedule yourself for those right from there. I think that's it for all the prepared stuff that I had to present, but I'd be happy to answer any questions or chat here. Looks like we've got a question in the chat about Apple Health.
Yes. Can you see it?
Yeah, when you're notified about new medical information for Apple Health, do you manually enter it into Apple Health or is it automatically entered? So that's automatically entered. So that would, well, I take that back. It could really be both. Either it can either be information that you enter manually into the health app, so you can manually take like blood pressure readings and put those into the health app, and then those will go to your provider. Or if you've got smart kind of connected devices, you can configure those to automatically upload into the health app. Yeah. And the process from LMH is all automated. So right when a provider puts a note into your record, you'll get that notification right away.
Any other questions out there amongst all of you?
Can we use the messaging system for any LMH employee, or is it just our doctors?
This site is just doctors. So this does save to your medical record. So we do really want to really limit conversations to just the user that's signed into the site and just to medical conversations, because that does save to your medical record.
I was thinking more like conversations with the nurse.
Yeah, so I can go back out to that part of the site here. So the way the messaging process works is you are selecting a provider here, but all messages are reviewed by that provider's nursing staff before the provider takes a look at it. So you can use this as a way to just send a message to a nurse that's associated with one of your providers. Yep.
Okay. Looks like Ellen Paulson has her hand raised. So Ellen, did you want to ask a question? Type it or unmute and ask?
Yeah, my question is, I had my portal on and followed through in the demonstration, and some of the options he shows are not available to me. Is that because of different I'm using Windows? Could that be the reason, or should I reinstall something, or I just wonder why it works differently a little bit. It's not any big things. But like, for example, sending the messages, I can only send a message by typing in the first 2 letters of a person that I already know. I don't have a choice of like choosing a clinic or anything like that.
So if you start to type something like Heart Center, you don't see this longer list of providers like I get.
Let me try it here.
There really shouldn't be any restriction around that. If you're not seeing a list like that, I can look into it.
Okay, I do see. Okay, so I just need to know which clinic they're in, and then I can get that. Okay, got it. And the first screen where you sign on, you were able to sign up from the right-hand corner to sign in to the portal. Right there. When I click on that, it doesn't give me the option. I have to go down to the, yeah, mine is clear down on the second screen. That may just be a setting. So
Yeah,
that's not a big deal. Not a
that
big
might be
deal.
screen size or something like that. Yeah.
And you're saying that none of the records are available from the cardiac department, but they're available to other staff members, right? It's just not to me.
Yeah, and really the only restriction around cardiology right now is the procedure report itself. So if you have a procedure done in our cath lab, that's the one we can't show you today on portal. But like your provider notes from like a follow-up visit with one of the cardiologists, those will be there on the site.
Great. Thank you. Appreciate it.
Huh?
Okay, any other questions? Pretty, pretty quiet.
Yeah. So are not all the doctors are actually listed on the portal, is that correct?
So all of our ambulatory doctors, so the folks you see in the clinics will be on there.
Okay, but not your primary? Mine's never been on there.
Who is your, well, I don't
Yeah,
know if you would get into
Dr.
that, but-
Allen, I'm fine telling you that. Maybe she's just in under a different thing. Oh, there she is. Why have I never been able to find her? Maybe I've got an old version. Provider.
The only folks that you won't see on here are like our providers on the hospital side or the emergency department. Those
Okay.
folks don't do messaging through here, but anybody you see in the clinics, really, you should be able to find them in that search.
Okay.
Taylor, do you have to search by their last name or first name, or does it matter?
Shouldn't matter. So if I search for, yeah, I can search for Michael for Dr. Zabel.
So maybe you just can't schedule an appointment for everybody this way, correct?
That is true. So
Okay, that's
yeah,
what.
it's a fairly small subset of providers that you can
Okay.
self-schedule with today.
Okay.
Okay.
Great. That's my obstacle.
Now I was looking at something else. Shelley has a question here. What if I'm looking for a new doctor? Can that
So-
be handled on the portal?
So we can't really support sort of self-scheduling with somebody brand new. Really, that's intended for after you've established with the provider, then you can start to schedule and communicate with them through the portal. But we do have links out on the lmh.org site where you can find providers that are accepting new patients and get a hold of them, start that process of scheduling over the phone.
There's also, under that Find a Doctor feature, there's videos of all the physicians, so you can kind of watch a little video and get a little more information about, I don't know, their overall vibe. I feel like it's kind of helpful just to kind of have an inside look at who they are and what they're about. I found those to be really helpful.
And I see find a new primary care provider. That would be something similar on the screen right now. Oh, you just clicked on that. Okay.
Yeah, so this specifically lists the primary care providers that are accepting new patients.
Accepting new patients.
And if I Looks like a few of them have videos, so yeah, I can get a feel for what they're like.
All right. Are we going to watch a movie? Great.
Any other questions?
Oh,
That was very thorough. Is there a way to know? I know you probably constantly are making improvements and upgrades and all that kind of stuff, but is there, I mean, do you do that on a schedule, or, I mean, is there a way to, like, if you need the, I don't know, if there's any sort of updates, are those just automatic, like you can, they happen, or it's not like you get like a notification on an iPhone or whatever for, system updates, but do you
system
guys?
update, yeah.
Yeah, when we do something big that would affect like the way you find something on the site, we can put a little sort of banner at the top here.
Okay.
We've done that a few times when we've made bigger changes.
Okay.
And when we do an overhaul later this year, we'll have links out on the main pages too for what all is changing and what to expect when you sign in, that kind of thing.
Okay, perfect.
How old is this portal? I mean, how long has this been up and running with LMH Health?
Ooh,
Probably quite some time.
I think I'm thinking about 15 years. We went
Yeah.
live with the first version about 2010. Yeah.
Uh-huh.
Wow.
It takes some doing to get used to them,
Mhm.
but they are helpful.
And hopefully with the mobile app is a fairly, been within probably the last 5 years or so. That's fairly new for us.
Yeah.
So
Mhm.
that makes it a lot easier to access since it's right there in your phone. You don't have to type your password to get into it.
Right.
So hopefully that's more convenient than the website.
Do we have any other questions out there among the viewing public? How to do anything, or why can't I? We'll take the why can't I questions, I suppose. Although those are a little more vexing.
Let's see.
I have a lot of why can't I questions personally with things, but just kind of plow in, see how you come out.
The innovations we've made with that pre-registration process and especially the digital arrival that we've just started to roll out they're one of those things that was kind of my why can't I for a long time.
Yeah,
So that's it's been really nice to get those moving.
yeah.
Oh, okay. Keep finding new areas. It's like, oh, I didn't know that was there.
Yeah, there's so much.
Well,
I personally don't do my doctoring in Lawrence, but I'm wondering how far out I mean, you probably wouldn't be able to remark possibly, but how far out are you scheduling appointments? In other words, I know that's a ridiculous question because there's probably only about 300 or 400 doctors, but it seems like it's harder and harder to get appointments close to whenever you've called. I'm just wondering how's it rolling for LMH Health these days? Are you pretty swamped? It's maybe not your department, but might be something to wonder about. He's got no, he's up. He's reaching for a Coca-Cola.
Sorry, I just had a weather radio go off. That was odd.
Oh.
Okay. Oh, the weather radio. Let's talk about, everybody knows snow is coming, and don't light a fire.
That's right.
Yeah.
So I know that that varies provider to provider, and obviously the specialties are, you know, more in demand just because there's fewer of them.
Right,
I will say our partnership with KU has been nice to bring some of those KU services over to the West Campus and
Right.
get those done closer to home rather than having to go all the way over to Kansas City. So
right.
we are making some headway there, I think.
Good. There's a question. What are some home devices I can connect to Apple Health? Blood pressure machine, any others that you mentioned that, and diabetes blood sugar monitors? What else
Yeah.
can you hook up to Apple Health?
Yep. So I've got one of those wrist blood pressure monitors that I use that automatically syncs up with my phone, and then all that goes into my medical record, which is nice. The same for the blood glucose monitors. If you're needing to keep a chart of your blood glucose rather than having to write that down and make copies, you can get a smart monitor and have that automatically sync. There's smart scales, so that would automatically write your weight and body composition and things like that into your record as well. I'm not sure what else is out there. I know those are kind of the big ones, just because it's the stuff we really need to track at home. But that's an industry that's kind of exploding too. So we're happy to have that Apple Health connection in place because we can kind of bring in whatever new stuff Apple connects with. We just kind of get to piggyback on that and bring it into our record. So it's pretty slick.
Well, this is off the beaten path, but I have to tell you that Taylor was my cyber aide back in South. I was at South
South
middle
Junior.
school, yeah, junior high for like 25 years, and I think he was either my aide 1 or 2 years. But anyways, I thought, well, that's Taylor that's doing all of this, and so it's pretty fun to see. Anyway, he's done a bang up job, hasn't he?
He has. Very
Yeah.
much.
Yeah.
Yes, that's part of the fun of the 3 degrees of Lawrence.
Yeah, that's right. And at South, we were cyber aides because we were in the center of the library, and we had to do the computers and that kind of thing. And so we coined it cyber aides instead of library aides.
It's
So
back when South was a big circle.
that's right. When we were in the old school. Yeah.
That was quite a school. People were always going around in circles.
We still are.
I know. Okay, are there any other questions? I don't see any up here, but I do know there's so much to learn. Kathleen can speak to my ability with tech. My goodness, I'm learning. It's a big challenge, but just to encourage everyone you're here because maybe you've learned. I've had a few people write to me and say, oh, I already use it. I know how to do it. And I thought, good for you, because that's really great. But if you're not at all feeling comfortable with it, I think that you just have to jump in and click on things. I'll practice my psychiatry here saying, growing up when I did, the last thing you wanted to hear someone say in a startled voice is, you broke it. There was a lot of that going around. There was a lot of that going around when I was growing up, and the last thing you wanted to do is break anything. But I've been assured by many people you cannot break these things.
No.
So don't worry about it. Get in here and jump. Let's see. Oh, someone said I already use it, but I learned a lot that's new, and that's true. It is amazing the stuff on here. My goodness, it's pretty amazing all that information, how to find all that stuff. It's very helpful. And particularly on our phones, when sometimes we're waiting for something and you see you have a message, to be able to take it, not have to go home and fire up. My particular laptop is wood burning. That's how it works. So it takes a while. I have to build a nice fire, get it warmed up, and cross my fingers and hope that I have connection. I'm out here in the middle of nowhere, but it's really very, very helpful. Does LMH do telehealth, Zooms between doctors and patients? Is that something that's going on?
Yeah, we do. So,
Okay.
kind of like everybody else, we had plans for that before the pandemic, and then the pandemic hit, and we had to speed all that up. So,
Yeah.
yeah, we do telehealth appointments. We partner with a company called Amwell. So that I think they will send like an email out with a link. You don't have to have a password for that one, which is good. So
He's mentioning that because I said before we even came on that so many people feel like I should have that up, but I don't want another password. It's just, we don't
that's
want to have, but
that's the other part I wanted to mention for the self-registration and digital arrival processes is that you don't need another password for that either.
okay.
We just send you a link, you confirm your name and your birth date, and you're in. No password for those. So
Excellent. Yeah. Any other questions about all of this? Looks like it's a wonderful tool. It's wonderful to have access to your doctor, to your records, to everything, medications. Pretty impressive.
Wow. Yeah, great development.
Yeah. Really good.
thank you.
Will we be able to access this video again, or so you'll send it out so that we can take a look, since for whatever reason, I just couldn't get in again, but Kathleen got me in, and I'm not sure.
Good.
I don't know. I think I must have a hex.
No,
But
I was tracking your progress here, and I was thinking, oh my, I don't know what to say.
Yeah,
Okay.
it's recorded, and once we get that sent back to us, we'll send it out. To
Oh,
everyone.
great.
Yeah,
Great.
so you can see it from the beginning.
Okay.
Yeah, sorry about all those issues.
Yeah.
Great.
Okay. Well, if there aren't any more questions, I guess we can all have a cup of tea or move on toward finding
Get ready for the snow.
the snow shovels and our salt and prepare. But really, thank you so much, Taylor, for sharing all of this with us and showing us how to do it. It looked super easy when you were doing it, and I'm sure we could also follow through. So thank you so much for that. And if there aren't any more questions, I guess we'll be done. We'll get out of school early today. The kids always like that. I wanted to let everyone know our next Gray Anatomy that will be in April is going to be about strokes, prevention, the latest information about strokes. And we're going to have a physician. We don't have anyone exactly scheduled yet, but there'll be a member of that specialty that will be speaking with us. So we're looking forward to that. And we thank you, Allison, for setting these things up. Taylor, you're a library aide who made good.
That's right.
They taught you well.
Yeah, they taught you well. So thank you for what you do. Thank you, everyone. Thanks, everyone, for being here. And I guess we'll see you next time. Stay warm. And
Thanks.
we'll see you again. Thanks
Thank-
for being here today. Bye, everybody.